Welcome back to Reproductive Health with Miss McClellan. We're going to talk about STDs today, also known as STIs. I don't really know why some people don't want to say diseases. Maybe it just sounds so bad, and maybe it's like a technical difference, but they're both commonly said. Um, I'm going to go ahead and warn you. There are some pictures in this one, and the pictures are gross, and the pictures are of genitals. Um, so just go ahead, just warning you. And there'll be like a slide that says gross pictures are coming up or something like that before I actually show you the slide with the pictures. Okay, so here's some facts about STDs. 1 in 4 sexually active teens becomes infected with an STD every year. That's a lot. 1 in 4 is a lot. They are communicable diseases, meaning you get them from someone else. You don't just sprout them. The surest way to prevent them is by abstinence, which you probably remember from the last presentation. However, some STDs can be contracted through the mouth, through open sores, sharing needles, blood transfusions from mother to infant in the womb or during birth. So when we say sexually transmitted diseases or infections, it's not always transmitted through sex. Usually, yes, but there are a few other ways you can get it. A really good way to prevent STDs is through monogamy, meaning having just one sexual partner. You want to make sure that your partner is someone that you trust and that you have both been screened for STDs if you've had previous partners. Sorry, I've been talking a lot. I just recorded the other one, so my voice is getting a little tired. Condoms are the only form of birth control that help prevent STDs. And we mentioned that in the last video, but just to reiterate, nearly 20 million new STD cases appear each year, with the majority affecting 15 to 24-year-olds. That's very young, and in fact, it's your age group. So this is very important for you guys. You're at peak age for this kind of thing to happen. Not just by virtue of you being young, but honestly, primarily by virtue of people your age not having the information that they need. But that's why I'm here. Where can STDs grow? The pathogens that cause STDs need a warm, dark, moist place to grow. Ooh, moist. We hate that word. I don't really, but a lot of people do. Those conditions are provided by mucous membranes, and these are the places with mucous membranes: your penis or your vagina, your anus, your nose. Don't touch an open STD sore and then touch your nose because the infection can spread. Your eyes, your mouth, or cuts. The second most communicable disease in the United States after the common cold is chlamydia, which is an STD. That's terrifying, actually. And again, communicable means you get it from somebody else. So common cold is what people get from each other the most. Chlamydia is the second. So you might have heard that STDs are easily treatable. If that's true, are they really all that dangerous? Yeah, actually, a lot of STDs do have treatments. Some have treatments, but not cures. And a lot do have really dangerous results if they're left untreated. Results like cancer, sterility, meaning you're not able to have children, pelvic inflammatory disease. Your pelvis is inflamed. That's not good. Kidney, heart, or liver damage, blindness, ectopic pregnancy. And again, that's when the egg is fertilized inside the fallopian tube and starts to develop there. That's really not good. A baby cannot survive there. So it's a real problem. Nervous system damage, brain damage, mental illness, or possibly worst of all, death. We don't want those things. There's 3 types of STDs. I see you guys in my mind's eye already looking at that last one and being like, what? Yeah. Bacterial, viral, and insects. If it's bacterial, it means it can be cured with little damage to the body if it's caught early. And the ones there are gonorrhea, syphilis, and chlamydia. I feel like those are 3 that we hear about pretty regularly. And the good thing about that is that they do have cures, but you want to make sure you catch them early. If it's viral, it can never be cured. It can be treated, but not cured. Genital warts, genital herpes, hepatitis B and C, or HIV and AIDS. Those are all examples of viral STDs. And insects, oh God, can be cured with little damage to the body if caught early. Again, scabies. Wonder if you guys can see that. It's about my tattoo I'm getting, whatevs. And pubic lice, which we also call crabs. They are not actually crabs, by the way. They're not like tiny little crabs like you would see on the beach or something. They're lice. All right, so we're going to get slightly more graphic for some more specifics about these STDs. Let's talk about chlamydia. Most women will have no symptoms of chlamydia, so they don't even know they're passing it on. This is one reason it's important to get tested. It can cause serious permanent damage to the reproductive system. It can cause fatal ectopic pregnancy. It can make it difficult or impossible to get pregnant later. You can still contract it even if the male does not ejaculate. Some people think that you can only get diseases if there is ejaculation, and that's not accurate. Untreated in women, it can travel to the uterus or the fallopian tubes, and it can cause pelvic inflammatory disease. Oh, gross pictures, I know. Some symptoms, stuff we want to avoid. Yes, that's a throat up at the top. And that's a penis down at the bottom, and neither one of them looks healthy. For women, you could get a burning sensation while urinating, abnormal vaginal discharge, nausea, fever, painful intercourse, vaginal bleeding between periods. For men, you could have a burning sensation while urinating, penile discharge, pain and swelling in one or both testicles, and both men and women could have rectal pain, discharge, or bleeding. So let's talk about pelvic inflammatory disease. That's an infection of the female reproductive organs. It can involve pain in the pelvis and lower abdomen, abnormal uterine bleeding, painful or difficult urination, fever, pain or bleeding during intercourse. It's often a result of chlamydia or gonorrhea. It can result in infertility, chronic pelvic pain, and other reproductive issues. So let's talk about syphilis. This is one of the other big bacterial ones. Usually starts as small sores on genitals, rectum, or in the mouth. And early syphilis can be easily treated, but left alone, it can cause damage to your heart, your brain, or other organs. It's actually horrifying. There was this Johnny Depp movie called The Libertine where, it was like a period piece from back in like the 1700s or something. And he played this count or something who had syphilis. And by the end, like his skin was gross. His nose was like falling off. His eyes were like clouded over. It was bad. And that's what used to happen to people who had syphilis because we didn't have treatments back then. The disease can lie dormant for years before you notice any symptoms. But symptoms you might notice would be a rash beginning on your trunk and covering the whole body, wart-like sores in the mouth or genital area, hair loss, muscle aches, fever, sore throat, or swollen lymph nodes. Ready for some pictures? Oh, just kidding. I'm going to kind of just go through this pretty quickly, but primary syphilis, it goes through stages. The first sign of syphilis is going to be a small sore called a chancre. That appears at the spot where the bacteria first entered your body. Some people develop several chancres. It usually develops about 3 weeks after exposure. A lot of people who have syphilis don't actually notice that because it doesn't hurt. And particularly with women, it can be hidden in the vagina. With either, it can be hidden in the rectum. But it heals on its own. So you'd be like, oh, I had this weird bump and now it's gone. And again, I just want to draw attention to the fact that for a lot of these diseases, actually, women don't know they have it for a long time because all of their symptoms are internal. It's more common for men to realize they have these things because they'll have visual symptoms on their penis because their sex organs are external and women's are internal. So within a few weeks of that original chancre healing, you could experience a rash that begins on your trunk, like I mentioned, but eventually covers your entire body, even the palms of your hands and the soles of your feet. Oh no, it's usually not itchy. You might have wart-like sores in your mouth or genital area, all those other symptoms we mentioned. And again, they might disappear within a few weeks, or they could repeatedly come and go for as long as a year. If you aren't treated for syphilis, it moves from secondary stage to the hidden or latent stage when you have no symptoms, and you might not have symptoms for years. Um, and maybe it'll go, like, maybe you'll never have any symptoms again, but you might, and it might progress to the tertiary stage. Tertiary just means third, by the way. About 15 to 30% of people who have syphilis and don't get treatment will develop complications known as late syphilis or tertiary syphilis. And it can damage your brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. Johnny Depp in that movie definitely had tertiary syphilis. You can have neurosyphilis, which means it can spread to the brain and cause damage there, and cause damage to your nervous system and to your eyes. Oh no. And then there's a thing called congenital syphilis. Babies who are born to women who have syphilis can become infected through the placenta or during birth. Most newborns with congenital syphilis have no symptoms, although some have a rash on the palms of their hands and the soles of their feet. Later, symptoms might include deafness, teeth deformities, and saddle nose, which is where the bridge of the nose collapses. And they can also be born too early, be stillborn, or die after birth. Very sad stuff. There's your pictures there. It's not a good, this is bad. This is not good. It's pretty gross. All the pictures except for the bottom right are infected penises, and that other picture is the sores that you would get on your body, on the trunk. Moving on to gonorrhea, sometimes called the clap. It most commonly affects the urethra, throat, uterus, or cervix. It can cause no visible symptoms, since most symptoms occur in the urinary tract. But it can be treated and cured with antibiotics if it's found early enough. For women, it can cause abnormal vaginal discharge, painful urination, irregular vaginal bleeding, abdominal or pelvic pain. For men, painful urination, pus-like discharge from the tip of the penis. I think we saw that in the last slide. Pain or swelling in one or both testicles. And then for both, it can cause anal itching, spots of blood on your toilet tissue when you're wiping, straining during bowel movements, eye pain, sensitivity to light, pus-like discharge from eyes, sore throat, swollen lymph nodes, or swollen and painful joints during movement. You've got up here at the top, male and female. So you've got a penis that's obviously got some discharge, and a vagina that does not look healthy. And over here, sadly, you can see it in an eye and crusted over in a baby's eye. Very upsetting and sad. Let's move on to genital herpes. More than 50% of adults have oral herpes, aka cold sores and fever blisters. That's not the same thing. It is a form of herpes. It is not genital herpes, and it is not an STD. About 1 in 6 people ages 14 to 49 have genital herpes, but a lot of people don't know that they do because of the lack of external symptoms. It's viral, which means it can't be cured with antibiotics, but medications can be used to ease the symptoms. And you can see the tip of a penis here that has these little bumps on it, and it's not good. These small red bumps or tiny white blisters. I kind of wish I could zoom in on that just to show you guys how they do look sort of like blisters. But you can see that it's not great looking. Pain, itching, or sores in the genital area, ulcers, or scabs, and the signs and symptoms can recur off and on for years. So then what are genital warts? Sounds similar to herpes. Well, genital warts are caused by HPV, which is the most common STD. It can go away on its own, but some high-risk forms of HPV can develop into cancer. You cannot get genital warts by touching genitals with normal warts, like on your hands or your feet. Like normal warts are not an STD. They're just a thing that happens. It spreads through skin contact, so penetration and ejaculation are not necessary to spread it. There is a vaccine for HPV, which is a series of 3 shots. I think it is pretty expensive, actually, even with insurance, if I recall correctly. But that's okay. This is probably my least favorite picture. I'm not gonna lie. I'm really upset by this one. You can tell, even if you don't really know what these things are supposed to look like, that this looks wrong. So you've got at the top there a penis that's infected with HPV, and at the bottom an anus. It's really bad, so I'm going to move on. Guys, you don't want this to happen to you. So let's talk about pubic lice and scabies. Gross. Both of these are small insects that burrow into the skin, in the case of scabies, or in the hair in the case of pubic lice. The pubic lice is also known as crabs because the insect kind of resembles a crab, kind of. We don't have pictures of those, by the way. And now HIV and AIDS. This is really important. You cannot get HIV and AIDS through hugging or kissing, eating after an infected person, shaking hands, working with an HIV or AIDS sufferer, living or working with them, coughing or sneezing, swimming in a public pool, toilet seats, or insect bites. People have, like, AIDS has only been, not that it's only been around, but we've only been able to identify and diagnose it since the 80s, which in the grand span of time is not that long. But back then there were a lot of misconceptions about it, and people were so like really horrible to people who had AIDS because they thought they could get it through all these things that you can't get it through. You can kind of see here the main symptoms of HIV on the left and AIDS on the right. And my statistics here are probably about 4 or 5 years old for the record. But the number of people that are living with AIDS and the number of people that have died from it, particularly in developing and moderate income nations. On the left here, we have all these horrible symptoms of acute HIV infection, and kind of divides it by different systems and stuff. So like swollen lymph nodes, rash, nausea and vomiting, malaise, which is like tiredness or weakness, headache, neuropathy, which is painful nerves. You can get that from shingles too. And having had shingles, I can tell you, you don't want it. Fever, weight loss, pharyngitis, sores, thrush, which is an infection of the tongue, sores on your esophagus, myalgia, which is muscle issues, and enlargement of the liver and spleen. If it progresses into AIDS, encephalitis, which is swelling of the brain, meningitis, which is also a brain issue, retinitis, infection of the retinas, pneumocystitis, pneumonia, just using the medical knowledge I have from being a weird child who read medical books growing up and also has a very close friend who's a physician's assistant, and as someone who has watched 17 seasons of Grey's Anatomy. Pneumo, lungs, cystitis, infection of cysts on your lungs, pneumonia, we know what that is, tuberculosis in multiple organs, tumors on your skin or in your lungs, esophagitis, inflammation of the esophagus, chronic diarrhea, and tumors. Bad news bears, all of it. More than 1 million Americans have HIV. And again, these statistics are probably 4 or 5 years old at this point. 37% of people ages 18 to 64 in the US, we're just talking about the US here, have reported receiving an HIV test. HIV education is mandatory in 33 states and in Washington, D.C., which is pretty great. 5 states alone make up almost half of new diagnoses. 2011. Wow, it's 10 years old, actually. This information is 10 years old. I got to update it at some point. California, Florida, Texas, New York, and Georgia. I'm surprised by New York. less surprised by the rest of them. The number one thing we can do, guys, is just educate ourselves about these things, arm ourselves with information, know what to do. I'm not going to go through all these statistics with you guys, but you can go back and look at these. This one, though, bottom left, modern day antiretroviral therapy reduces the chances of an HIV positive person transmitting the virus by 96%. That's pretty awesome. That's a thing that has not always existed. And then the middle at the bottom, a new pill known as Truvada or PrEP can reduce the risk of transmission by more than 90%. And I've actually started seeing commercials for PrEP on Hulu lately, which is kind of cool. So just to kind of review, we've got bacterial, viral, and insects. Bacterial can be cured with little damage to the body if it's caught early. Viral can never be cured. And insects, like bacterial, can be cured with little damage to the body if caught early. Symptoms that you never want to ignore: warts, bumps, and we're talking about in your genital areas, rash, itching, discharge, pain when urinating, or sores. So we know that these are symptoms of a lot of different STDs, and you want to be careful, and you want to make sure to get those checked out so that you can start getting treated as soon as possible. If you suspect you may have an STD, do these things in this order. Number 1, stop having sex immediately till you get it figured out, till you know what you have, till you get it treated or cured. Stop having sex because you don't want to pass it on to anybody else. Go see a doctor and get tested. And if you are positive, if you test positive, tell your partner so that they can get tested as well. I'm trying to move on. Is that my last slide? Oh man, I don't have like a question slide or something on the end. Well, as you know, if you have any questions about any of this, by all means, email me, come find me at school. I'm not embarrassed to talk to you about any of this stuff. I won't make you feel dumb. I won't show you any more gross pictures. Just let me know if you have any questions. I'll see you next time to talk about resources, making decisions, and being responsible.